Welcome to the deep dive. Today we're tackling a really interesting area, how doctors are feeling about and using artificial intelligence in their work.
Yeah, it's definitely a hot topic.
We've got two key pieces of info from the American Medical Association, both from February this year. First, there's a quick rundown of their latest survey findings.
And then the full report, the Augmented Intelligence Research PDF, quite detailed.
Right. So our goal in this deep dive, as always, tailored for you, is to really get into what this means.
Exactly. Go beyond just the surface numbers. We want to pull out the most significant insights, how that relationship between physicians and AI is actually changing.
Highlighting the shifts in attitude, the opportunities people are seeing.
And the concerns that are still there. Definitely still some concerns. We'll try to do it without drowning you in stats.
Good plan. And speaking of significant shifts, here's something that really jumped out at me right away.
Oh, yeah. What's that?
The number of doctors actually using AI in their practice nearly doubled just in 1 year.
Doubled. Wow.
Yeah, it leaped from 38% back in 2023 to 66% in 2024. A whopping 66%.
Okay, that is dramatic. So let's unpack that. What's driving this shift in just the overall feeling about AI?
Well, what's interesting is how the sentiment is swinging, maybe subtly, but definitely towards the positive.
Right. The AMA survey, it shows that in 2024, 35% of doctors felt more excited than concerned about AI.
Okay, 35%. Doesn't sound like a massive majority,
But
but
it's up. It was 30% the year before. So clear increase. And at the same time, the ones who were more concerned than excited, that number dropped
how much did it drop?
from 29% down to 25%. So fewer feeling primarily worried.
Okay, so it's not like this tidal wave of pure excitement washed over everyone.
No, definitely not.
But the trend is, well, optimistic-ish. But a lot of doctors aren't fully on board yet either,
But
right?
precisely. You've got this big chunk, about 40%, still right in the middle. They feel the excitement and the concern pretty much equally.
The cautious middle.
Yeah, which kind of suggests they're really thinking it through, engaging
Right.
with it thoughtfully. It's not a simple yes-no thing for them. They're probably watching how it all unfolds.
That makes a lot of sense. I
Yeah.
mean, this is a huge potential shift for medicine. Careful thinking is probably smart.
For sure.
Jesse M. Ehrenfeld, he's the AMA's immediate past president. He had some interesting things to say about this.
Yeah, he did. He pointed out that physicians are, and I think this is his phrase, increasingly intrigued by the assistive role of health AI.
Assistive role. Okay.
He really stressed the potential for these tools to help with some of the big pain points, the daily grind stuff.
Like what specifically?
Things like cutting down on that massive administrative burden, paperwork,
Oh, yeah. Always a big one.
making diagnoses potentially more accurate, and maybe paving the way for more personalized treatments for patients.
Those sound like, well, really significant benefits if they pan out.
Huge potential, yeah.
But he didn't just focus on the positives, did he? There were warnings, too.
Absolutely. He definitely included some important caveats, raised concerns about potential design flaws in the AI itself,
Right.
the ongoing need to protect patient privacy, which is always critical, the challenge of getting AI to actually work smoothly with the current electronic health record systems.
Which we know is a nightmare sometimes.
Exactly. A big hurdle. And then the risk of AI actually giving incorrect recommendations. Plus, this whole complex area of new liability questions. Who's responsible if something goes wrong?
Okay, so definitely a mixed bag. Big opportunities, but real challenges and risks, too. Let's dig into where doctors see the clearest advantages, the real upside of using AI.
So, the survey data shows this growing agreement on the benefits. In 2024, 68% of physicians said they see at least some advantage to using AI tools in patient care.
68%, that's up a bit from the year before.
Yep, just a nudge up from 65% in 2023. But the feeling that AI offers a definite advantage, that's all a bigger jump.
Oh, really?
Yeah, from 22% saying definite advantage up to 28%. So it feels like it's moving from just, theoretical potential to more concrete perceived benefits.
Right. Okay, so it's becoming less abstract. Doctors are seeing more tangible ways it can help. Where specifically are they seeing these advantages most clearly?
Well, a few areas really pop out. A big majority, 75% in 2024, think AI can really boost work efficiency.
Efficiency, okay, 75%.
And close behind that, diagnostic ability. 72% see a potential positive impact there. They also expect better clinical outcomes. That's 62%. Help with managing cognitive overload, which is a huge deal in medicine. 50% see AI helping.
Cognitive overload. just too much information to process.
Exactly. And even potentially reducing stress and burnout, 44% think AI could help with that.
Wow, that burnout point is really compelling. We hear so much about that.
It really is.
Were there any areas where the perceived helpfulness maybe didn't grow as much or even went down, like maybe revenue or patient privacy concerns?
Well, the report doesn't specifically highlight decreases, but it's clear the biggest jumps in perceived benefit were around that efficiency, the diagnostics, and easing the admin burden.
Gotcha.
So you could infer that maybe other areas, while still on the radar, didn't get that same surge of optimism this past year. The immediate focus seems to be on tackling those really pressing daily frustrations.
Okay, so the immediate wins seem to be about making the day-to-day work more manageable and helping them make better diagnoses. Let's shift gears slightly. How is AI actually being used now, and what's likely coming soon?
Right. This is where that almost double usage figure really comes into play.
Yeah, the 38% to 66% jump.
Exactly. The survey shows a big rise in AI adoption for specific tasks. One of the top gainers was visit documentation.
Writing up notes after seeing a patient.
Yep. Huge time sink. We're also seeing more AI used for generating discharge summaries and care plans,
Okay.
and also helping doctors keep up with medical research, summarizing standards of care, just managing information.
So really practical stuff that it's core physician tasks and, like you said, information management. Are doctors generally getting more familiar with all the different ways AI might be used?
Absolutely. The report suggests familiarity is growing across a wider range of uses, like AI translation services for patients who speak different languages,
Oh, interesting.
tools for automating documentation, obviously,
Mhm.
even things like chatbots, maybe answering common patient questions.
Right.
But even with that growing awareness, it's still really clear that AI focused on documentation, that's what's most relevant and, frankly, top of mind for most physicians right now.
And where's the most enthusiasm? What applications get doctors most excited?
The strongest excitement is definitely centered on AI that tackles that documentation burden head on.
That makes sense.
Tools for getting billing codes right, filling out charts and visit notes faster, generating discharge instructions, care plans, summarizing complex patient charts quickly. It all comes back to wanting to cut down those time-consuming admin tasks.
It's interesting, though. AI use is way up, nearly doubled. But the report also says a fair number of doctors are actually unsure if they're even using AI, especially for the non-clinical admin stuff. How does that work?
Yeah, that's a really interesting point, isn't it? It probably reflects how AI is getting baked into the software and platforms they already use.
Ah, so it's working behind the scenes.
Kind of, yeah. Operating maybe somewhat invisibly. A doctor might use a feature that's AI-powered without consciously thinking, oh, this is AI. Especially in things like, say, scheduling software or billing systems that have built-in automation.
Okay, so it's becoming more embedded, maybe less noticeable sometimes in their digital tools. Now, we've mentioned it a few times, but let's really zero in on that administrative burden. The survey makes it crystal clear that this is seen as a huge opportunity for AI.
Exactly right. Over half the physicians surveyed, 57% in 2024, see automating those admin tasks as the single biggest potential benefit of AI.
57%, and that's held steady.
Pretty much. It was a top priority last year, too, just a slight tick up from 56% in 2023. And like we've been saying, the actual adoption trends right now, heavily focused on those documentation tools that hit this problem directly.
It's really clear that getting time back from paperwork is a massive driver for doctors embracing AI. But what needs to be in place for even more doctors to get on board? What are the key requirements or maybe the roadblocks?
Yeah, the survey gives us good clues there. Physicians overwhelmingly said they need a clear way to give feedback on AI tools. That was huge. 88% stressed it's important.
The feedback channel. Okay.
And strong guarantees about data privacy. That's right up there at 87%.
No surprise there.
Not at all. Then, seamless integration with their existing EHR systems. 84% said that's critical.
The EHR integration again.
Always. And proper training and education on how to actually use these AI tools effectively. Also, 84% top-tier priorities.
Those all sound pretty fundamental, don't they? They need to trust it, know patient data is safe, have it fit their workflow, and actually know how to use it properly.
Thanks, perfect.
How does that list compare to what they felt was most important last year? Any shifts?
There is a noticeable shift, actually. In 2023, the top things were data privacy, still high now, obviously, and then worries about liability.
being held responsible if the AI makes a mistake.
Exactly. Protection from liability for AI errors was tied with privacy at 87% last year, and having adequate medical liability coverage was right behind at 86%.
So liability was really front and center.
It was. The fact that things like a feedback channel and smooth EHR integration have kind of risen to the very top this year, it suggests a move towards needing more practical support and, well, better usability as AI becomes less theoretical and more part of the daily routine.
Interesting. So liability is still a big concern, clearly, but the immediate practical needs, usability, support, integration, are maybe becoming more prominent right now.
That seems to be the trend, yeah.
Well, what about regulation? What kind of rules or oversight do doctors think are needed to build more trust in AI for healthcare?
Increased regulatory oversight came out number one. 47% ranked it first as the most crucial thing for building trust.
Almost half. So they want governing bodies to step up.
It seems so. A desire for more active involvement in ensuring AI is safe, effective, and used responsibly in medicine.
What other regulatory actions were mentioned?
Well, things like setting requirements for how insurance companies use AI, for deciding what's medically necessary.
Oh, that's a big one. Payer use of AI.
Yeah. Also, more oversight for AI tools that might not be traditional medical devices, clearer rules about telling patients when AI is being used.
Disclosure to patients.
And linked to that, the need for getting patient consent for certain AI applications.
Okay, so a definite call for more structure, more accountability around how AI gets developed and used in healthcare. Now, related to that, how much influence do doctors feel they actually have on tech decisions in their own practices? And how much input do they want when it comes to AI specifically?
Well, interestingly, the survey showed a slight dip in how much influence physicians feel they have over tech decisions generally.
Oh, really? Less influence.
A little bit less perceived influence, yeah. But a strong majority, 52% in 2024, still firmly believe they absolutely need to be consulted before decisions are made about adopting AI tools.
Half still want to say, even if they feel their overall influence might be waning slightly.
Exactly. It suggests that even if direct control feels like it's slipping a bit, they see having a voice on AI adoption as really vital. It directly impacts their work, their patients.
That seems completely fair. They're the ones using it, right?
Right.
Okay, finally, when doctors are trying to understand these AI tools, what kind of information do they find most useful? And what's the best way to actually get that information to them?
So when they're evaluating AI, they really want, first off, just a clear, simple list of the main features. 80% said that's key.
Just the basics? What does it do?
Pretty much. They also really want to know how the AI's performance is monitored over time. 79%. Needs to be reliable.
Makes sense.
A clear explanation of its intended use and the specific benefits it's supposed to provide. 78%.
No vague promises.
Right. And being upfront about its limitations, its potential drawbacks. 77%.
Transparency about what it can't do.
Crucial. And also getting a clear, understandable explanation of how the AI actually reaches its decisions or recommendations. That's also 77%. They want to understand the why.
So, transparency, practical details, knowing the good and the bad, that seems to be the theme.
Definitely.
And how do they want this info presented? What format works best?
They prefer stuff that's easy to digest quickly, bullet points, list things they can scan easily. That was favored by 78%.
Quick hits.
Yeah. Real-world examples showing how it's used in practice are also really helpful. 74%.
Yeah. Seeing it in action?
And visual aids like icons or diagrams also score well. 72%. Anything that makes the information more accessible and relates it back to their actual work.
Makes perfect sense. They're incredibly busy to need the essential info, clearly and efficiently delivered.
Well, this has been a really great exploration into how physicians are seeing this evolving world of AI in healthcare.
It really has. A lot is changing quickly.
Let's try to sum up some key takeaways for you, our listener.
Absolutely. I think what's really striking is that growing willingness among physicians to actually embrace AI, especially for tackling those nagging administrative burdens.
That admin piece keeps coming up.
It does. But this growing acceptance, it's clearly tied to some critical factors. They need robust safeguards for patient privacy. That's non-negotiable. They need AI tools to slot seamlessly into their existing systems, mainly EHRs.
No clunky workarounds.
Right. And they need clear, effective regulatory oversight. That's crucial for both safety and just building trust.
And that rapid jump in adoption we talked about.
Yeah, that near doubling in just 1 year. It really highlights that a significant transformation is already well underway in medicine. It's not just coming, it's happening now. So on that note, here's a final thought for you to mull over. Given this incredibly fast pace of AI integration into healthcare, how is this evolving partnership, this relationship between doctors and AI, how is it ultimately going to reshape the patient experience? And maybe even the fundamental nature of how medicine is practiced?
That's a big question, isn't it?
It really is. Definitely something worth keeping a very close eye on as all this continues to unfold. Thanks for joining us for this deep dive.